about 6 years ago, I went to talk to the pathologist, and they're like, we never see ulceration from kidney disease. So it's like, how did that perpetuate itself? It must have just gotten into textbooks, and then everybody...
It's because cats were treated like small dogs and small people. Probably more common in other species. Right? And that's just what we've seen happen.
Yeah, definitely.
So I think this is how these things got established.
Yeah.
Sorry for Saying Sorry Media presents the Purr Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary healthcare team. If you're dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and textbook author, and Dr. Yola Kerpenstein, talented surgeon and social media geek.
This is Dr. Susan Little, and I'm with
Dr. Yola Kerpenstein.
And where are we, Yola?
We are in beautiful New York City.
And why are we here?
Because of New York Vet.
No,
Susan.
we're here to eat oysters.
Oh, that too.
He forgets the important things.
We're here for oysters.
And New York Vet.
And New York Vet. So oysters.
New York Vet. Yeah, absolutely.
I need to get some oysters. I had no
idea.
idea.
Really. We can fill you in.
Okay.
Yeah.
Yes.
And we're really lucky because we get to talk to some cool people here at New York Vet. And one of them is Dr. Katie Tolbert. So thank you for being with us, Katie.
Thanks for having me.
So tell us a little bit about yourself.
My personal or professional
Whatever
life?
you would
Yes.
like.
Yes.
Reveal as much or as little as you would like.
It's an open mic here.
Awesome. No, I'll stick to professional. Well, I am born in Lexington, Kentucky, raised in Atlanta, Georgia. Went to University of Georgia for my vet school and internship, and then PhD and residency at NC State, and then I was at the University of Tennessee for 6 years, and now I'm with Texas A&M.
When
I
did you
was
start
an
at Texas?
intern in Georgia too.
You were? We share that in common. Go Bulldogs.
Yeah, go Bulldogs.
Probably at a little
as a matter of
different
fact, we have a
time.
house in Atlanta. So,
Okay. Oh, good. Yeah, it's a good city. It's a good
Long
city.
time ago.
Yeah.
Long time ago. So you fairly recently moved to A&M, right?
Yes, I actually left Texas A&M. Left Tennessee in September.
Yeah, that's what I thought. Cool.
Yeah.
Okay, so here's a big question.
Yeah.
Do you have a cat?
I do not have a cat right now.
Why not?
I used to have 2 cats.
Really?
And then my partner is very OCD.
Oh, I thought you were going to say allergic. Okay.
No, she is not allergic, but she cannot handle a litter box. And we both kind of have I love outdoor cats, but then we also have a really big songbird population around our house. So there's like that. So I would love to have cats again. We may have to come to some sort of agreement.
I can help you out with that. Should you ever?
Yeah. And we totally forgot to talk about the D word that is not to be mentioned.
Yes.
No, we
okay.
can't talk
We
about
have a rule.
I've heard that we cannot
talk
about it.
Here's
It's
the
okay.
rule.
Here's the rule.
And you know what happens if you say the D word?
Oh no, do I get punched or something?
No. It's much
We're
like
non-violent.
We're non-violent.
Okay.
You might have to buy us a glass of wine.
Oh,
Yes.
okay.
Yes.
All right.
Per
I'll do
D
my
word.
best.
So
I don't make that much
Some
money.
people rack it up quite high.
Okay.
But Stan
Marks.
he didn't say any.
That
I
is
know.
shocking to me.
It
I
is.
know. He had really good self-control, I have to say.
That does not. Those 2 things don't compute. Stan and
Yeah, he did a good
self-control,
job.
like-
He did a good job. So we'll see.
Okay, I'm not gonna
now
do
you've got
it.
a standard. You've got a standard.
Okay. Oh my God.
Yeah.
Cool.
Okay.
So there's a big thing that I wanted to talk to you about, and that is that ACVIM just hot off the press released some consensus guidelines on gastric acid suppression in dogs and cats.
Yeah.
Much needed.
Yes, definitely.
And full of cool stuff.
You said it, and now you owe me a glass of wine.
I did, but it's in the title.
Yes, you did.
We didn't say it works the other way around.
Yeah, no,
okay,
it does.
she's too sharp.
She's
too sharp.
I love it.
I've had 5 cups of coffee.
It's
ready
in the
to go.
title. Oh,
Tonight.
Okay, Katie, you got me.
Okay, no, it's all good.
Okay.
It's all good.
So you're one of the co-authors on the paper. Remind us who else is on that consensus statement.
Stan,
Stan Marks.
Mike Willard, and Peter Cook, and Mark Papich.
Yeah, cool.
That's
Okay.
awesome.
A good group.
So,
As a matter of fact, I published, I saw that on, I think Susan saw it on social media.
Yeah.
She posted it.
Yeah.
I posted on the Global Veterinary Surgery site, and it's one of the highest interaction pieces
we
that I
get
send
lots
out
of comments when we've been
Good.
posting
Quite a lot.
about that.
That's great.
So why did we need a consensus statement like that?
Just like I was, talking about in my seminar here, is that people use acid suppressants so irrationally. Like there's no, like sometimes, like for example, at my own hospital, or when I was at the University of Tennessee, and now I actually do clinics at NC State, I'll walk into the ICU and an animal is receiving pantoprazole, and I'm like, what, trying to look through a medical record, try to understand why, and there's no indication whatsoever. And, there's the cost associated with that. It's an additional injection. There are risks of injections, obviously, in cats especially.
Yep.
And then there can be adverse consequences that we don't really understand yet in dogs and cats. So we needed that. And the consensus statement does cover other things like misoprostol, sucralfate, that sort of thing too. I just want to mention that.
You said the D word.
Oh, okay, we're even.
So
we're even.
This is a really good podcast for me. So, I like it.
We wipe each other out.
Now,
back to baseline.
I have to warn you, Yola's a surgeon.
Okay.
And I'm a medic. Okay.
Yeah.
And so sometimes we have. There might be
some disagreements
or tension.
Yeah.
No, it's not that. It's
some
love.
inherent.
It's love.
And I love it when we get a topic that really doesn't have a lot of surgery in it. Like this topic.
As if I don't know anything else. Then cutting out little animals.
So the consensus guideline covers like a broad range, right, of things. So you mentioned things like sucralfate and like H2 blockers, and so again, tell me what else.
Before we go there, can we talk a little bit about writing an article like that? Because
good question.
I've written quite a lot of articles, and it is so painful if you do it on your own. Let alone when you do it with so many people. How do you get this consensus?
Because it's called a consensus.
Yes. So just to start back at the beginning, we actually started doing this consensus statement in 2014. So we presented it at the ACVIM. We talked about it there. We actually had, a skeleton of a paper. So it's taken us 3 years to put this all together. So it was a big endeavor. We all kind of basically split sections of it that was more related to the research that we did, and then essentially sent all of those documents around to say, what do you think? Do you have edits, et cetera? And we did that, hundreds of times, honestly, and then came to this sort of put it all together.
It's a real process.
Oh, yeah.
Isn't it? It's a consensus statement is a little bit different, obviously, to put together.
Yeah.
You have to tread quite carefully, right?
And it's interesting because you have, so we have 5 authors on this paper, and everyone has a different writing style. So it's about compromise and, letting things go or whatever.
So it's a good life lesson.
Yeah.
Of all the things that you made consensus about, which one was the most tough one?
Actually, we pretty much agreed on everything, I think. I mean, for the most part. I mean, because there's a lack of evidence for everything that we said, basically. But we agreed on pretty much everything. I think the one that's the most interesting, to me at least, is the prophylactic use of acid suppressants for conditions such as, you have immune-mediated hemolytic anemia, and you're giving steroids. Should you give gastroprotectants prophylactically? You have a healthy dog who has osteoarthritis. That should we give a PPI or not? And so that, to me, we didn't have a lot of conflict about, but was like the most important, interesting thing that I think we needed to get out there to say, when is it appropriate to use prophylaxis and when is it not?
So let's dive into that for cats then, because cats are often on long-term corticosteroids.
Yep.
They're often on long-term NSAIDs.
Yep.
Right? So let's dive into that. Are there times when it makes sense to prophylactically use a gastric acid suppressant?
Yeah, I think cats are really interesting as a species in terms of their development of GI ulceration because it's not very common.
Yeah.
Compared to the D word, they don't get it very often.
Yeah, there's that paper that you were involved in, I think. The one that looked at the postmortem.
Oh, no, that wasn't me.
But
that was a good one.
The one
the lip tap one.
Yeah.
Yes. And it's just not common at all in cats. And so some of that may be because of differences in their sort of intestinal microbiota or the way that they metabolize drugs. For example, the way that they metabolize a lot of the NSAIDs is very different from the way that dogs do. The way that dogs have enterohepatic recirculation of NSAIDs, and they have really high concentrations that go out of their bile into the duodenum, and because of that and their microbiota, that's probably why the D word is more susceptible to NSAID-induced ulceration, whereas the cat, we think about things like, acute kidney injury, et cetera.
Yeah, we think of different things.
So for me, there's no way that I would think about prophylactically giving a gastroprotectant in a cat for those conditions because it's so uncommon that they would develop ulceration. Now, if you had a cat who had mast cell tumor and you were giving steroids, that would be the time where I would think about some sort of gastroprotectant. Obviously, something like well, you wouldn't do that. Let me go back. Why would you do that? Give steroids and NSAID together. But let me think of a different example. Maybe you had a mast cell tumor and the cat also had osteoarthritis, so you're giving it NSAID or something. Two risk factors coming together. Yeah. That's the time where I would think about doing a PPI.
Yeah. So the other
and PPI stands for because there's a lot of people.
Proton pump inhibitor.
So like
Prilosec,
Nexium. Yeah. So the other place that I have chronically that I've seen these drugs chronically used are in the chronic kidney disease.
Yeah, it drives me nuts.
Doesn't it? It drives me a little bit nuts too.
Yeah.
Well, in the beginning it didn't drive me nuts because I didn't know any better. Yeah. Right? And then one day you go, why are we doing this exactly? And then it started to drive me nuts. So let's talk a little bit about that because historically it's been common to do this. Why did we do it historically?
Yeah, well, I think anecdotally people think that it increases their appetite. So that's what I hear. Like it decreases vomiting, it increases their appetite, and so that's why people do it. And again, I'm not sure that I believe that. We have a study that's funded by the Morris Animal Foundation right now that we're doing with Jessica Quimby, which is a randomized double-blinded clinical trial where we're giving cats with stage 3 and stage 4 chronic kidney disease omeprazole or placebo, and then they cross over. And so we're going to see, does it actually stimulate their appetite? Awesome. Does it increase, does it decrease vomiting episodes, et cetera? Does it do anything with their attitude? And so hopefully that will help sort of answer that question. But the thing that really, so I don't know that I believe that it necessarily will hurt the kidneys or do anything harmful to the cat. How I think it harms the cat is that how many drugs are you already giving that cat?
I agree.
And it's a cat.
It's polypharmacy.
Even, all the studies that we do in healthy cats, thinking about giving medications to them makes me, my skin crawl a little bit.
I agree.
Do you know what I mean? And so then going to a cat that doesn't have an appetite, that doesn't feel well, that's vomiting, and you're, having to give all these medications, the owner's stressed out about that. Just take one off the table because they don't need it. So that's why it's, sort of my soapbox.
Yeah, I think that's really where we need, to look at evidence base and prioritize what drugs we're going to give, right?
Exactly.
And I think we also used to assume that cats got, uremic gastritis, and maybe they don't.
Well, we understand now that they don't, and I think that it's the weirdest thing where I learned that in vet school that kidney disease was a cause of ulceration, and then about 6 years ago I went to talk to the pathologist, and they're like, we never see ulceration from kidney disease. So it's like, how did that perpetuate itself? It must have just gotten into textbooks, and then everybody.
It's because cats were treated like small dogs and small people. Probably more common in other species. Right, and that's just what we've seen happen.
Yeah, definitely.
So I think this is how these things got established.
Yeah.
This episode is made possible by the generous sponsorship of the Take the Pledge Against Struvites in Pets Facebook page. Did you know there are 3 easy steps to treat bladder stones in cats with lower urinary tract signs? Step 1 is to take a radiograph, and if there is a stone present in the bladder, step 2 is to use the Minnesota Urolith app for iPhone and Android to determine the most likely type of stone. Step 3 is to treat the cat for at least 2 to 3 weeks with an appropriate diet and see if the stone gets smaller. If so, keep feeding that diet until the stone is completely gone on follow-up radiographs. If not, check compliance with the owner and look for alternative treatment options. Join veterinarians worldwide to take the pledge not to remove struvite stones by surgery anymore.
I think, that's really cool. And I also think that in the last couple of years, it has been such a change between also the amount of drugs that you can get right now. So we started, there was only antacids that we had in the beginning.
Like just famotidine, or not even cimetidine.
I know, we started with cimetidine, and that was the only thing that you had, and then now we have this whole plethora of drugs. And how do you know which one to use and when to use it?
Yeah, especially in cats, right?
Good question. That's the thing where I'm I try to teach veterinarians, what is the effect that you want? If you want to stimulate appetite, give an appetite stimulant. If you want to decrease vomiting, give an antiemetic. If you truly believe that the cat has upper GI ulceration, which is uncommon in the cat, then that is appropriate to give an acid suppressant. Otherwise, you really shouldn't be using it.
I think a lot of vets have had the probably mistaken thought that especially the H2 blockers act like antiemetics. Because I get that quite often, that they're treating vomiting, but they're not antiemetic.
No, not at all.
Yeah, they don't have any antiemetic effect.
Yes, and again, I hope that the study that we're doing now will, you never want to hope for something as a scientist, but my hypothesis is that the acid suppressant will not do anything for a number of vomiting episodes in these cats, and that will show.
So that's what that's your end result then that you look for, the number
Yeah,
of
kind of
vomiting
similar to Quimby's studies that she's done in the past, where, for example, she had that meropenem study, mirtazapine study, where she's looking at weight loss,
vomiting episodes,
appetite, vomiting episodes. So it's very similar in the study design. Just in this case, we are giving omeprazole.
Yeah.
So if we look at the highlights of your paper, pick some out of them that were kind of when you were because in the beginning your mindset is pretty much like this, and you said you didn't have that many dissonance within the group, but still, are there things that after you have written the paper that you're really happy about, that it is now open in the air?
I think one of the biggest things is, again, sort of making sure that we're not misusing these drugs. I think the other thing is just thinking rationally about whether or not these drugs work. Again, because I'm dying to do a compliance study in cats. Dying.
Let's talk.
Yes,
because
dying.
We so need compliance studies.
We need compliance studies,
Yeah,
especially as it relates to things like chronic kidney disease.
Oh my gosh.
Quimby and I have talked so many times about we have to do this. We should talk.
Yep.
So that's the thing for me. Is is it effective? Is there evidence? So for example, people want to give sucralfate and Pepcid, sucralfate and a PPI, and there's really, unless the animal has pain, not a good reason to co-administer those drugs. Sucralfate is just not a good drug for upper GI ulceration in the dog and cat, and it's definitely, and if you look at human studies, meta-analyses, sort of as monotherapy, the PPI is far superior. So that's the one of the things that I really like about the consensus statement is it's sort of saying, okay, what's the evidence? When should you give this drug, and when is it not appropriate?
So when would we use? Let's talk about sucralfate. When would you use that in a cat?
So if the animal has severe esophagitis, if it's pain or mucositis, very effective for mucositis. And mucosal healing of mucositis, very effective. For esophagitis, probably not as effective for mucosal healing, but great for pain. So the sucralfate slurry, people say, I've talked to Dr. Papich about this a lot. I have to call him Dr. Papich because I did my residency at NC State. So even though we're colleagues now, I always will refer to him as Dr. Papich. But anyways, he and others, basically have said before, the suspension that's available is probably better than taking the tablet
and
making
a slurry?
Making a slurry, because of the viscosity. So now I tend to use that, even though it's more expensive.
Yeah, but you'll get better coating.
But you get better coating, and I think it's probably better for pain. So anytime I have an animal that has esophagitis that's inappetent, that I think is probably because of pain, or they have tylism or nausea or something like that I think is pain related, then I will give sucralfate, but otherwise I don't give it.
So here I have my cat.
Yes.
Here I have the sucralfate suspension.
Yes.
What do I need to do to not get the sucralfate suspension on me, but
luck.
into the cat?
E-tube.
E-tube, but that's the way.
That's the way.
Yeah. So that's
otherwise, there's no way.
And how do you get that then against
if
the
you have
gingivitis
mucositis, you're
thing?
screwed. I mean, you have to give it orally because that's the way it works. I don't know. I mean, that's the thing.
Yeah.
For us as veterinarians, and why I keep trying to come back to the compliance issue, think about your owner. Is your owner physically able? You may think this is the best drug. It's so indicated. There's great rationale for using it. But can you get away with not using it? Because your owner is elderly and she has rheumatoid arthritis.
And she has nobody to help her.
Or the cat is going to hide underneath the table. Do you know what I mean? I think that's the thing. Especially.
She has beautiful white furniture.
She has beautiful
white
furniture.
White splotches on it.
Exactly.
Yes.
So, I mean, that's the thing as veterinarians that I think we have to get back to is, we put a lot of pressure on our clients to do all these things. And sometimes they're not going to admit to us that they can't.
Absolutely. So where I really started to think about that. So this is a minor segue. I'll try not to go down a rabbit hole with this. But my mom and dad are in their 80s. My dad's passed away last year. But anyway, they're in their 80s. And I used to, in later years, go to their regular doctor's appointments with them. And their doctor would ask them to bring everything that they take. So drugs, vitamins, minerals, everything. And I started to think, why? Because the doctor's prescribed everything. Well, one of the things they're checking is compliance. Just because it was that blood pressure pill was prescribed to my dad, does he maybe not take it because there's a side effect he doesn't like? And this is very unexplored with cat owners.
I totally agree. And we've started to do it now. Well, we started to do it at Tennessee. Shelley Olin is a really big proponent of this as well, just to let's just mark in the record. Let's not shame them.
Yeah.
But let's mark in the record when it looks like there's more pills than should be there. Yeah. And then when we see that maybe the IMHA is not responding like we thought, maybe it's not that we need to add another drug, but see, like, how are things going? Like, are you able to get the pill? And I know this must be really difficult for you.
Yeah, we
like,
need to learn
how to
have that conversation, right?
Yeah.
Because otherwise, the owner's going to feel like they have failed.
And they won't tell you. I mean, that's the thing. So my dad has a D, and the dog has horrific skin disease, and my dad has to give these, allergy injections, the subcutaneous injections or whatever, and the dog hates it.
Yeah.
And it really has disrupted their bond. Like rumors,
we
the dog,
underestimate that,
she
don't we?
like goes, she hides. My dad stopped giving the injections.
Yep.
Because...
And he's not going to want to feel like a failed owner.
Right, yeah.
Right? It's going to be difficult to admit that.
He didn't tell the veterinarian. He told me, and I'm like, Dad, like, we got to do something.
We do.
What can we do? How can I help you?
Yeah. So I think you're right. We need to learn how to be more practical and think about that human-animal bond, especially for chronic treatment of disease.
Yes.
And we also need to learn how to talk to owners in a way that's not going to...
Be empathetic.
Yeah, we need to be empathetic. And we also, in our own mind, if we think the owner's failed, it's going to come across.
Right, exactly.
Do you know what really helps? I'm sorry again, I'm going down this rabbit hole. So my own cat, who's now long gone, had IBD, pancreatitis, and diabetes.
Oh my God.
And if, so my husband and I are both veterinarians.
Yes.
We're both boarded veterinarians.
Right.
We felt like complete owner fails.
Yeah.
And it really opened my eyes to what we're asking owners to do. If two boarded veterinarians can't manage their cat.
Yep.
And he was not the tough cat.
That's the thing. It's when you go through your own experience. Like, I had an animal who had gastric carcinoma, and he was very sick, and he didn't want to eat, and he didn't want to take medications, and they sent me home with 6 different medications, and I'm looking at them like, okay, which of them today am I going to get into? Because I'm not going to get all 6 of these in, because you're going to hate me, I'm going to hate myself. It's going to disrupt everything about our relationship. So let me pick a couple. And that's the thing I think about cats, for example, with chronic kidney disease. If you have to give 4 different medications, can you tell the owner, listen, this one, if you have to try to get this in. And then all these other ones would be really, really great for your cat. But it's kind of icing on the top.
Gotcha.
But this one has to get in.
So you need to prioritize.
You have to prioritize. And we don't do that.
No,
we
don't.
give a discharge instruction that basically is here are the medications, here are the instructions.
You've got to do them all.
Yeah.
Good luck.
And I think papers like this consensus statement also help us know what drugs don't need to be on the list.
Yes.
So even better if we can get some drugs off of the list for these chronically ill animals.
I think it's important because we tend to send people away with a lot of drugs without showing them how to give them.
Yeah.
And for me, I was always challenging my students and say, okay, what I want you to do is show them in the exam room how to do it.
Yeah, good
and
luck.
if you find out that it's really difficult, the owner's not going to use it.
Right, I totally agree.
Yeah.
I totally
because
agree.
that is a thing that we overlook so easily.
Yeah.
Yes.
It's the art of veterinary medicine too, though. I know it sounds like kind of a soft skill, but it's a really important skill to put yourself in the owner's position.
And I think it just comes with experience and age.
Yeah.
Do you know what I mean? When I first got out into practice, I would have been that person that was and here are 10 medications.
Sure. I think we all are. We all were. Yeah.
These are indicated.
Absolutely.
There's good evidence for you to give them.
Absolutely.
Do it.
So thank you so much once again for this first part
Thanks
of our
for having
podcast. It's wonderful to have you here, Katie, and so we all we're so excited that you'll be back in 2 weeks, obviously in the same location, but
time travel.
Yeah, we're time traveling all the time, but it's very much appreciated.
I'm I am.
Yes, exactly. And the interesting thing is from literature is not everybody has time to read it, so this is wonderful for our audience to get kind of a overview of why and how.
From an expert from the panel. Thank you.
I know, love it. So thank you so much.
Thanks for having me.
The opinions of this podcast are those by Dr. Susan Little and Dr. Yola Kerpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian. If you're a veterinary professional, ask your questions on our Instagram page @PerPodcast. Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatVetSusan. Dr. Ursula Kerpenstein is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Yola works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GVETSX.